Switching gears now to COVID-19, and even though our daily case count here in Ohio was down more than 250 cases today from yesterday, this was still the third day in a row where our case count has exceeded 1,000. When it comes to hospitalizations, we have seen just a small increase as only 2% of our state's hospital beds are occupied by COVID-19 patients. But remember, they tend to lag behind cases, so those could be moving up soon.
Well, we now have more Northeast Ohio counties that are in the orange, as you can see, which means there's substantial transmission. Medina, Lorain, Erie, Huron, Richland, and Ashland counties are all now on that list. Carroll County has dropped back to moderate transmission.
A lot of this is directly due to the Delta variant. We've been telling you so much about this, as well as the unvaccinated. Monica Robbins joins us now. Monica, good afternoon to you. A lot of people want to know this question. You're fully vaccinated. Does that mean that you cannot pass the Delta variant to someone who's not protected?
Does that not mean, well, no. If you're fully vaccinated, can you get COVID? Yeah, you can get COVID. And yes, you can pass it on to somebody who's unvaccinated, which is the big problem.
Sure.
Yeah, so yes, it is possible. And we also know it is possible for a vaccinated person to potentially give it to another vaccinated person. But we know these vaccines are not 100%. You need less of the Delta virus to transmit infection. We also know that breakthrough infections are also on the rise. But the bigger risk is a vaccinated person infecting an unvaccinated person, which is why these mask guidelines are changing back, especially indoor areas where ventilation is less. And while those breakthrough cases are happening, the vaccines are still 97% effective in preventing severe disease. That's what they were meant to do in the first place, and that is incredibly important. But the other safety protocols, such as masks and distancing and hand washing, all those other things we've known about for the last 18 months, we still got to do.
All right, so of the people hospitalized with those breakthrough infections, is there a record of which of the vaccines they were given? That's kind of a topic of conversation.
Yeah, a lot of people want to do that. I called the state today. The state does not keep that data. The majority of the 200+ people hospitalized and the 34 who died were often older and immunocompromised. Experts tell me it is safe to assume that the vaccine was a mix because both mRNA vaccines had the same initial efficacy and J&J was slightly less. Now, despite the breakthroughs, again, overall the vaccines are still very good at preventing severe disease, which is very important, and we can see that in our hospitalization rates.
Sure.
There is a slight incline. They are going up a little bit, but not like the case numbers are and everything else and what we're dealing with around the country.
All right. Now, one of the things we haven't really talked a lot about is deaths, and I took a look at those today because I haven't looked at them in a while. Over the past 14 days, we have still had 79 deaths here in Ohio. Now, that's paltry compared to where we were at our peak. It's about just under 6 deaths a day. This is still killing people.
Yes, it is. And from January 1st of this year, what the governor said on Monday was we had 7,000 unvaccinated people die from this. And as of Monday, it was 34 people who were fully vaccinated, most of which all had immunocompromised situations, medical conditions, and they were older.
Again, proof is in the numbers. Vaccinations are keeping people alive.
Yep.
All right, Monica, thank you very much.